We also got word this morning from Regeneron about its antibody cocktail and Omicron, and that news hasn't been great either. Meg Terrell joins us right now with a wrap-up of all that's taken place. Hi, Meg.
Hi, Becky. I would agree with you guys. I don't think the world has changed much this morning in terms of what we know about the likely effectiveness of the vaccines and drugs against Omicron. We did hear from Moderna CEO Stéphane Bancel yesterday about this. I think we have a clip from him we can play here.
If you look at the new virus, it has the Delta mutation, it has the Beta mutation, and many more on the spike, up to 32 mutations. So we anticipate that there'll be a loss of vaccine efficacy to prevent disease.
So he says, we anticipate there will be a loss of vaccine efficacy to prevent disease. We heard the same thing from Albert Bourla yesterday, the CEO of Pfizer, who said he does not expect that the efficacy of the vaccines against Omicron will be 95%. Importantly, what we heard from both CEOs, though, was the plans that the companies have in place to look at their vaccines against this variant, get the data within about 2 weeks about how well the vaccines should hold up, and use that information to decide on their strategies. But already they've started designing new vaccines targeting Omicron specifically, and they're looking at whether booster doses, Moderna's double the dose of the cleared booster dose, could potentially be enough here. So we're going to have to wait for a couple weeks to see that. Meanwhile, Regeneron putting out a press release this morning essentially confirming what we had already been hearing from folks like Dr. Scott Gottlieb and scientist Jesse Bloom, who's done some modeling work on the antibody drugs. Regeneron saying there is no data yet definitively to say, but modeling suggests that its antibody drugs may lose some of their activity against the Omicron variant, but they have next-generation antibodies. They say a large collection of them, some of which have already entered the clinic. They say some of those next-generation antibodies may retain activity against this variant and others to come of concern. They expect more data over the next month. So, guys, my summary of this situation is the world is as we thought it was yesterday. There is some much concern about the effect that this variant will have on vaccines and antibody drugs, but the companies are working hard on it, guys.
Yeah, and that's an important point, too. Meg, the Regeneron shares are down by about 3.25% this morning on concern about that. But I think it's really important what you point out, that they're already working on next generation stuff for this. And we still don't know the details of exactly how much of their effectiveness they would lose. I mean, you're talking about coming down from incredibly high levels, north of 90% in terms of cutting down the number of people who go into the hospital or who die from this.
Yeah, absolutely. So what we've been hearing is that there may be still protection from the vaccines, particularly against severe disease. We're going to have to wait to see what the neutralizing antibody data look like first, and then any of the sort of epidemiological data that come out from the real world about breakthrough infections and the like. In terms of the antibody drugs, another really important point from Regeneron is that its antibody drug holds up against the Delta variant, which is 99.5% of circulating variants in the United States right now. So there's a really important message that if folks get sick and they're eligible for these antibody drugs, they will still work for the vast majority of people here in the United States. And then, of course, we have Merck's drug going in front of the FDA today, and that the antiviral drugs from Merck and Pfizer not expected to be affected by Omicron. So some optimism in here amid all of the concerns as well.
Thanks very much, Meg. Great to see you.